excited to actually not only have us talking, but to have some of our VIP students join us to talk today. And these students have been fantastic. They've been so patient as we've set this course up. Being the first lot is always, a little bit difficult, but I really wanted you to hear from some authentic experiences, I guess, from the course. So I'd really like to welcome Simon. Would you like to introduce yourself, Simon?
Oh, thanks, Claire. Yeah, so my name's Simon. I'm a clinician sort of by background, with a background in cardiac allied health. And through the last sort of 12 months, I've been fortunate that I've moved into a secondment where I'm actually working in a digital health role. So that link between IT and the clinician. So this course has been perfect for me for that transition so that I can sort of fill in those gaps that you require.
Thanks, Simon. Joey Sai.
Hey, my name is Jo. I'm a pharmacist. I'm currently working both in community pharmacy and in a GP office. Just learning about the digital health actually helped me basically talk to the patients about what's happening in terms of digital health, my health records and whatnot. So this course has just really, really helped things along. And yeah.
And Kerry Porter. I think Kerry has joined us from her holidays. Kerry, look at you in your car. Oh my goodness. I'm so grateful that you would take time out of your holidays to join us and share your experiences. So Kerry, please introduce yourself.
Thank you. I'm actually sitting at the beach watching the beach. So but I had to go in the car because we've got 6 under 5-year-olds running around and it was a wee bit noisy. Look, my name's Kerry. I'm a nurse practitioner in diabetes and clinical lead at the PA hospital. I will use the word pleasure loosely to go major hospital, go digital with Clair and when, to actually be on the beginnings of all of that frontier. And the course for me, the main thing was, I had a lot of the practical knowledge, but I didn't have any of the theory and stuff to back up what I knew. And so it was really about getting some a more rounded education than just the practical.
Yeah. And I think what Kerry's saying there is so true. People in the course like Kerry are actually digital pioneers. So she has transformed nursing workflows across Queensland. And so, in fact, I feel a little bit humbled trying to teach digital transformation to some of these students, but having her in the course has helped us improve things, I think, and so hopefully you'll see the benefit as the course matures. People like Kerry and Jo and Simon, their feedback will allow us to continue to mature the course. So these students are going to hang around. We're going to go through some slides, but I did just want you to have the ability to talk independently to some of the current students to understand their experiences and how it's helping them. So we'll go into the slides and then we'll stop and we'll be open for questions for the students to talk. I noticed one of our course coordinators has joined us as well, Dr. Sally Shrapnel. Sally, would you like to introduce yourself?
Thanks, Claire. Hi, everybody. My name's Sally Shrapnel. I'm an associate professor in the School of Maths and Physics at UQ, and I used to be a GP before I changed over. And I'm teaching course 3, which is the course on statistics and machine learning and analytics and AI and digital health.
And can I just say that Sally is the popular kid because she's teaching AI and machine learning, and everybody wants to hang out with Sally. Nobody wants to hang out with me and learn about how to persuade grumpy surgeons to change their workflows. So Sally is the cool kid with her AI and machine learning, and I'm not the cool kid, on the ground trying to get everyone to install an EMR. So kudos to the cool kid, Sally, and thanks for joining us, Sally.
Thanks, Claire.
All right, so we'll go across to the slides. I really wanted to outline a little bit, I guess, around the course, but before we do that, I would just sincerely like to acknowledge the fact that the traditional owners have really, for many, many tens of thousands of years, been learning. And so this course really, I guess, is continuing a tradition of learning around St. Lucia and Hurston and Buranda, and we're very fortunate to be able to continue that. I acknowledge any people of Aboriginal Torres Strait Islander descent who might be on this call and pay my respects to elders past, present and emerging. We've made a definite effort as part of this course to include First Nations content and to ensure that the solutions and the teaching that we're giving is culturally appropriate, in a hope of, a small hope that we might help to close the gap with some of our digital health transformation. Okay, so I don't need to tell this audience that the traditional methods of healthcare delivery are no longer sustainable. Look at the front page of the Courier Mail today around no obstetricians in Gladstone. Look at the issues that have been happening in emergency departments around Australia, and trying to do the same thing we developed in the 1950s over and over again is not going to work. Now, this is becoming apparent not only to healthcare providers, but also to government. And so these new methods of care are almost certainly going to be dependent upon technology. And we've really seen that during COVID-19, and all of you, I'm sure, were touched by the rapid implementation of technology during that time. But new technology comes with new capability. And we're increasingly finding that data, the data that's captured during individual consultations, is really powerful. And Sally, during her component of the course, will help us to understand how that can be used not only to make better decisions, but to predict potentially adverse events happening and maybe even prevent them. So we're kind of moving a little bit away from traditional history and examination, although these remain critical, to perhaps the compute power of the data collected during those activities. And that's something that I think is still very immature, but obviously holds great promise. So the reason we developed this certificate is because there isn't many people who can do this. And we are trying to attempt it, learning on the job, failing with digital health implementations, failing with our ability to not just do electronically what we did, but actually to change things altogether. We're working very closely with the Australian Institute of Digital Health to understand how we can fit the competencies that you'll develop during this into the new clinical fellowship framework, which is coming nationally. And I'm very proud to report that this curriculum out of the University of Queensland is the basis for the new clinical fellowship nationally. This course has been funded by the federal government. We received a grant from the Digital Health CRC, largely thanks to Andrew Burton-Jones' initial work. But it's meant that that kind of has given that federal government impetus to what we're doing and ensures that what you're learning here is appropriate nationally. Thanks, Andrew. When we were developing the certificate, we were really mindful that the people who are likely to be interested in doing the certificate are like Kerry Porter, running a full-time job and a family. And so trying to have a traditional student experience where you have to go to campus or the hours are not flexible is unlikely to fit the kind of people who we think should be doing this course. So we've deliberately designed it, assuming that you have full-time jobs, assuming that you have families, and try to design the load around those far more important commitments to make it doable, because I don't necessarily want to capture brand new grads with this. I want to capture people who are on the cusp of leading digital transformation or who are already doing it, who need that academic rigor and confidence to progress. Thanks. So we've really seen three streams of people coming to us. The first is clinicians, and these are clinicians who either are wanting to or are already doing digital transformation in their day-to-day work, or clinicians who are interested in a career in digital health. And that is clinicians who want to be, for example, a chief nursing information officer, a chief medical information officer, a CCIO, or a chief digital officer. And these roles are increasingly emerging in healthcare organisations. And in fact, I've just been speaking to Ramsey. So these type of roles are increasingly being developed, but no one's really sure who should be doing them. So we're trying to give that some structure and a curriculum so that if you are applying for that role, you can do so with confidence and with an academic qualification to back you up. We're also seeing corporate staff. So increasingly, normal functions in a hospital, such as information management, IT, increasingly need an understanding of digital health and data. And so this stream of people, I think, is often neglected. If you all think about your hospitals, the admin stream is often neglected, the corporate staff are often neglected, and yet they can be really important leaders in terms of digital transformation. So we are seeing that group come to us, and I think they're going to be fantastic in terms of leading digital transformation. And the third one is executives and administrators, or people who want to be that. So, you could argue now, and those of you who saw our paper in the MJA last month, that digital health is no longer a cost to be recouped. It is the most powerful quality improvement platform we have. So the data that we're collecting during digital transformation should and is starting to drive quality improvement. So if you're an executive director or a CE, an understanding of data, how it flows and how to analyse it is going to be really important for a future-facing organisation. Thanks, Andrew.
All right, so I might continue with this point from Claire, and then I'll go through the next slides, and then I'll open it up to the instructors who are here, and then the students who've joined us, and to share their experiences. This slide just continues from the previous one, gives you some numbers and details, but I think what we have tried to do is to create a program that would include all these people, enable them to all join in the course and the program, with the idea that actually the future needs them to collaborate. Like the digital health solutions need all three. So, if we can design ways within a program for people to get to know each other, work together, and so on, share ideas, that creates a more powerful educational environment too. In terms of the curriculum, we work very hard on this. There's continual improvements in this over time as well, as you can imagine. But broadly, it came from a global literature review and then a deep dive, particularly in the AMIA fellowship in the US, because they had taken the largest strides to get actual clinical colleges to accredit and endorse this educational framework. And so that's why, as Claire said, our work here has not only created a local university educational service product, but we're trying to create a national fellowship kind of exercise, and also have conversations with our counterparts in the NHS and in the US and so on. So it's not just a random set of bullet points here. The idea is that this is actually a whole suite of knowledge that professionals need to know as they develop maturity in this area. And this will continue to grow and get more professionalized as we go forward, just like in any other clinical area. So as you work through the courses, the idea is that you would develop all of the different skills and competencies that you would need as you start off in this area. In terms of pedagogy, we also worked hard on this. So we tried to split, application time, contextualizing things to particular contexts. What about health service? What about acute? What about primary care, and so on? Having opportunities for interaction and collaboration in the course, but also allowing time for personal reflection and evaluation of knowledge, both the evaluation of the student's knowledge, but evaluation of practices and processes that are done in hospitals, like how do we evaluate an EMR and so on. In terms of pedagogy, we also try to balance self-learning with learning from others. We try to balance synchronous learning with asynchronous, self-learning and different class notes. So it's an online program, but there's live elements in terms of, getting together on Zoom with the instructor. We have guest speakers, we have sessions in class, we have some sessions out of class and so on. But we tried to develop a package that meets the principles that Claire mentioned earlier about it's inclusive, it's, you can do this in your own time, but that there are also ways to collaborate and get to know each other and build a bit of a cohort and build a network, the kind of things that, you want when you do a university program. In terms of specifics, this slide basically says what you need to know in terms of it's a postgrad program, so you need a bachelor's degree before, or you could see the third bullet if having a full-time 3 years full-time experience. And the bullet point here, which says a bachelor's degree in the same discipline, we also, as those slides said earlier, we allow people to come in if you've got a business background or a computer science background, and they will be looked at on a case basis with the executive dean as well for entry into the program. In terms of costs, the costs of these programs are basically all in the same range wherever you're going around Australia. So there's different ones, but this is recorded, the slides, you can have a look at this if you want to look at this in more detail. The one thing that we're very pleased about is that different programs around the country are supported in different ways by the Commonwealth. So this particular program in digital health is seen as a priority area by the federal government. So they fund this. And so, in fact, the students that have gone through this have been funded. We can't guarantee that every single student, because we don't know ahead of time exactly what funding is offered. But what we can say is that the funding to date has been very strong, such that the indicative fee for the program is $4,000, so roughly $1,000 for a course, which is much less than would normally be the case. And if you have further questions about this, Buddy or the group can answer questions. But the Commonwealth supported places has been a wonderful thing for students doing this so far. And I don't know how long it would continue to last, so I guess the timing is good, but it does seem to be the case now.
Yeah. Andrew, we just had a catch up prior to the session, and Buddy, I don't know if you want to give the update that you gave me just prior to starting.
Yeah, thanks, Claire. So provided you meet the entry requirements for the graduates taking clinical informatics and digital health for the semester 1 2023, as domestic student will be eligible to receive a Commonwealth supported place. So we're really pleased for the government support to help students like you coming through the program and support you financially as well.
Yeah, so it's really exciting. Sorry, we only just found that out, Andrew. But that means that every student should receive that big discount on their course, which is, and I must thank the federal government. I must write them a letter or something. I don't know how we do that, but it's very nice of them to do that. So yeah,
it's good to get a Christmas present in January. So all right, well, that's great. Now then, applications for this year are due very soon. Applications close 31st. Then the details are here, the different information. We have probably the best way of doing this is just for me to move on. So if you have admin questions though, Buddy from the student team can help answer them. What I might do now is turn this over to the instructors and the students who are here who can help answer any questions. So we have Anton, we have Sally, and so on. So what I might do is I'll stop the share and maybe I could start with Anton. Do you want to just give a little bit of a brief introduction as to what you do in course 1, and then we might, Sally, if you can give a brief introduction with course 3 that's coming, and then we might turn to the students just to give your own experiences. We'll go from there.
Sure. So hello again, everyone. The course 1 really is a foundation, gives you a foundation of digital health and clinical informatics, from terminology, frameworks, the current state of digital health, as well as introduce you the workflows, data flows. So I'm particularly, I'm a core course coordinator as well as core lecturer. So there is a colleague of mine who is a digital health expert that will be covering that with me, and I'm a health economist on the course 1. So I will be covering the health economics component, which, as Claire mentioned, is very important these days, because we want to understand how the decisions are made around the funding, around how things are funded generally, how the interventions are cost effective, for example, as well as just to understand how efficiencies as well as opportunity costs, for example, are important in the decision making from health professionals, from policymakers, and etc. So those are the things that we will be covering in course 1. Happy to answer any questions if the specifics that you're interested in.
Thanks so much, Anton. Sally, do you want to just give a brief? Are you the cool kid introduced? So no pressure.
Yeah, no pressure. So hello again. So the third course is really about helping you understand what we can do with all this data. So when we have all this very valuable data that's being collected in digital health, how can we analyze it in ways that are useful and that can lead to quality improvement and better outcomes for patients? So the way we do this is we've broken the course into 3 sections. The first section is to give you a real grounding in the foundations of very basic statistics. So this is the kind of statistical methods that are bread and butter in health systems. And we've made it very conceptually focused. So you don't need any maths beyond about year 10 level And it's really about understanding the pros and cons of different methods and when they should be used and what the limitations are. Then the middle part of the course is the cool part, which is the machine learning and AI part, where what we're doing is going through the very basics of how machine learning works, what are the models that you're most likely to come across in practice in a clinical environment, and really how to evaluate those and what are the pitfalls of using them. There's a lot of hype surrounding this kind of techniques, but we want to make sure that you finish the course feeling really equipped to be able to evaluate and design these kind of analytical tools yourselves. Then the final part of the course is Anton, who you've just met, who's doing econometric analytic methods. And that's really around causal analysis and some other matching techniques that will be very useful. So I think the critical thing is when you look at the topics of this course, if you actually just look at the ECP, it can look a bit daunting because it looks like it might be a bit mathsy. There is no math, like there's very, very little maths in this course. If you can add up, you'll be fine. It really is more about, it really is more about concepts. So having said that, there's a lot of concepts. Like it's a dense course. There's a lot of information, but we've spread it out nicely throughout the semester. We're going to be running 2-hour workshops, one evening a week, every kind of second or third week. So there's 7 throughout the semester. So if anyone's having problems with any of the topics, we can do some kind of face-to-face, well, via Zoom teaching in those sessions. In terms of assessment, there's quizzes at the end of each module that you can do, which are worth 20% in total. And then there's just 2 projects. One is a project where we get you to analyze a machine learning method that was implemented. And then the second project is where we actually get you to design your own data analytic project and how you would run it if you were, you know, in a real clinical situation. So happy to answer any questions about course 3.
Thanks, Ellie. All right, maybe if I can just let the students share some of their experiences, and then we'll get into questions from anybody. And as Tyne's just mentioned, if you have questions that you'd like answers on, you can always drop them in the chat at any time, and we'll answer them as well as we're going along. So Kerry, I can see your camera's just come on. Why don't you start? And then maybe Joe and then Simon, I'll look at you to jump.
Thanks, Andrew. I think for me, yes, it was very daunting even thinking about starting it because I didn't think I had the knowledge or the skills to be able to do the course. But because you can actually do it within your area of expertise, then you're just actually building and growing on the knowledge that you've already got. The big advantage I found, which I was worried about in the beginning, is the multidisciplinary nature of it. The fact that I'm a clinician, but then I'm with administrators, I'm with other allied health, we're with non-medical people. And when everybody's coming from their own perspective, then you're actually getting a really well-rounded, I thought, oh, I hadn't thought about that, or wow, I actually didn't know that. And it also then helps in the language, like all I care about is the patient, but that isn't always going to get me the money or the work that I need. You know, it's about then putting on someone else's, well, what do I need to do to talk to this person to get what I need for my patient? And that's where that multidisciplinary nature of the course, I've learned as much from the other students as I have from the amazing instructors that we have who have made themselves so available to us and to learn from. And it's the interactive nature. It's been fantastic.
Thanks, Kerry. That's great to hear. Joe, do you want to maybe any of your experiences?
I guess to build from what Kerry said, well, when I first started, because I work in a pharmacy, so in terms of digital health, very, very small corner of what's out there. But you know, what got me was as pharmacists, because we're not just trying to learn new things in hospital. I actually met somebody who actually does the IMR side. So I was like, okay, there's more things that we can learn from. So when I enrolled in this course, I didn't know much about digital health at all. So I was like ground zero. What I have learned is even though the focus of the first course is there is an Australian focus, but it also then takes you worldwide to see what else have been used in digital health, and also, you know, what is happening around the world. The topic for the first assignment is fixed, which is good because it's kind of like a standard based, but the topic for your second assignment is flexible, so you can focus and build your knowledge of what you've learned throughout the semester. So, you know, as Kerry had said, because we are all from different, our cohort is just huge. So we have people that focuses on patients, and then we have people that focuses on the IMR side, the record side, and then we have people from the Digital Health Agency who then are more into the business side. So, yeah.
Thanks, Jo. That was great. Simon?
Thanks, Andrew. And pretty much just to build on what the other ladies have said, I was one of those frustrated clinicians that, you know, I thought that I could try and improve my little corner of the world. And initially I wanted to try and find a way that I could communicate better to my manager and executive, because, you know, I had some initiatives that I wanted to start. I was finding it very challenging to try and get across my point in a language that everyone could understand. As a clinician, you're very well versed in how to speak, you know, to your patients and those around you, but trying to communicate something where you may have a digital change, how do you communicate that up to people who aren't clinicians, and show the actual value and the impact of what you're doing? That's what drew me initially to this course. But what I found along the way was that, you know, my problems that I thought I had were minute compared to everyone else out in the world. I actually came from quite a well-resourced area. And then when you look at people, you know, like Joey, who works in community and pharmacy, you know, she said that she doesn't really have much of a digital health perspective, but it's just a very different perspective to someone who's working in a major public hospital. It's not just about whether you work with an IMR. There's lots of other things that contribute to digital health. And, you know, part of the mantra that's probably changed for me is it's not digital health, it's just health. Digital is just that component that's come into it. It's as important as being able to take a patient's obs and everything else, how you sort of plug in that digital component on the side. It's actually been a fantastic environment. A lot of us have got young kids, and many times, you know, we've got a late Tuesday night lecture and we've all got toddlers on our laps, and it's a very family friendly sort of environment. So it's very nice, and everyone's very supportive of that. If you need to jump offline, then we just continue on as usual. There's lots of that asynchronous communication offline as well. So while we do have that sort of more formal structure with the tutorials and the material, it's the conversations that you have as part of that tutorial, and then, you know, offline, where a lot of us catch up if we have, you know, not only questions with the course content, but also questions that we may have in our professional life as well. We've got those networks that we can sort of build on from there, and that's as important as everything else that we're learning, you know, from a didactic lecture.
Oh, that's super well said, Simon. Thank you so much.
Yes.
All righty. Well, like, questions are already flying in, so let's feel free to answer any, and feel free just to put up your hand and jump on, ask a question verbally as well if you'd like.
I've been answering some in the chat, Andrew, so maybe we just go through them so everyone is aware. So great question from Daniel around the importance of information for billing, essentially. And Daniel, you're so right. I think that there's been this disconnect really between what clinicians write and the billing. And so we do go through how correct documentation is important for billing. And, you know, obviously with your question, you've got a relatively sophisticated understanding of that as well. But some of the econometrics that Anton will go through also has the potential to help there. So I hope that answers your question, Daniel. Yeah. Off topic a little bit, but there is some work going on at UQ at the moment about how to automate that coding. So, you know, at the moment, how the charts go off to the coding department and then they're manually coded. That seems like a laborious step, right? So is there an ability for us to consider generating ICD-10 codes directly from the notes? So that's just a little aside. But yes, I can see you nodding there. Khushbu, you are wondering if we could do it in 1 year. I can't imagine that would be possible, but Buddy or Georgia, correct me if I'm wrong, but I think this is 2 years. I can't imagine doing all 4 modules at once. No, Georgia's nodding. So
yeah, they're kind of designed to be sequential in nature. So you do the 7301 and then 7302, and then you move through them that way. So they're building on, and you'll see if you look at the courses online, they have, you know, recommended prerequisites because they're designed to kind of work through them one at a time.
And Khushbu, UQ might be twice as long, but I promise you it's twice as good. So hopefully that helps. And the difference in the courses in semester 1 and semester 2. So just so everyone's clear, the modules are sequential. So we start you off in the basics for course 1. because what we're worried about is everyone wants to do AI and machine learning, but unless you actually understand coding and you understand information and the data cycle, you're not going to be particularly good at AI or ML in health. So we do go through the basics in the first course around what is terminology, how do we code it, what does the information look like, and then that basis really sets you up nicely to hit the cool kids in the AI ML course in 3. So we do teach you the fundamentals. You'll see the entrepreneurial guys who think they can do AI and ML straight off without going through those basics, and that's why it's failing. Right, so we are failing as a system because we don't understand it. So it does talk you through those basics at the start, and then once you understand the information flows and a bit more about the compute power of that information, then you go into the AI and ML. Good question there from Yannick. Practical component. Oh, this is so important. So I guess, you know, anyone can study digital health online. You can go to Coursera. But what we've done with this is make sure that you have people like the CCIO for Queensland Health come and talk to you. We have the Chief Strategy Officer for eHealth Queensland come and talk to you. And the contact with those people and the ability to ask them questions is really important. And so developing up that knowledge and that little cohort of people is really important. We have, I don't even know how many industry lecturers, Andrew, you might know, but you know, certainly well over 10, I would have thought, across all the 4 modules.
Yeah, so we design the I guess the learning so that you can have guests come within a class. We also have sessions where outside of class, we've had special sessions where we've invited people, often very senior people, to come along and give their perspectives. The other element to the question, Yannick, which was a good one, is you say, for instance, use the word assignment in terms of the actual assessments. So for instance, Claire and I will do the final course, and we have a lot of experience, particularly Claire has tremendous experience in, you know, how are strategies in the health service actually developed, how are digital transformations actually evaluated, and the assessments that we're designing and will be doing in the course are very closely related to what's actually happening in the health services. And so it's not like a toy problem or something like that that's disconnected from reality. So we're trying to make sure that not only do you meet people and so forth, but the actual content and assessment is also connected.
Yeah. Yannick, it's also worth noting that we have some employers have taken this graduate certificate and actually added projects to it. So we've just put 30 odd people through an executive version of this and leadership at Metro South. So these Metro South people did components of the course in parallel with actual projects in the healthcare setting. So we are seeing some employers also bringing the academic side of it back down into their workplaces. And we've just done the same thing with the Indonesian government. I think there was 25 healthcare workers from the Indonesian government who've done a similar thing. So I think increasingly we'll see that happening because I agree with Yannick, like we need to be practicing what we preach and understanding that the problems we're solving are real and that you've got the skills and confidence to do it. I think Kerry's got her hands up there. Kerry, go ahead.
I was just going to say also the assessments that we do in the course is really encouraging us to look at all the theory knowledge that we're learning to actually put that into doing a project, designing a project, presenting that project, how to cost that project, so that we are actually getting a lot of the practical side through the assessments that we've done. You know, often assessments seem to be for the sake of doing assessments, but I found these assessments have really stretched me and made me grow and to actually be able to put my money where my mouth is.
I don't think you need to grow too much, Kerry. She's outstripping me in some of those leadership expertise there, but it's very kind of her to say. There's a question there from Emma about group assignments versus individual. Anton, do you want to take that one?
Sure. For course 1, we have 3 types of assignments. The first one, we ask you to write 3 reflective tasks, and they're all individual assignments. So at different times of the course as we go along, you will have an opportunity to reflect on your learnings on a particular subject and module area. The second assignment is a policy review exercise where we give you a case study, actual case study, and ask you to provide an analysis of this using the knowledge that and skills that we've introduced you in the previous modules. And the third assignment for the course one is the video presentation, where there are a number of different cases and prompts that we give you and ask you to reflect on it and do the analysis and record a presentation of it. They're all individual assignments for the course one.
Yep. Does that answer your question, Emma? Okay.
Yeah, that's really interesting. Thank you.
Yeah.
Can I just add, Claire, we do run some exercises during the live sessions, and those are done in groups and breakout sessions where we have a case study, for example, and in breakout rooms, the teams answer different questions, and then we come back and have a discussion around those. So that kind of helps you to prepare to those activities that we do in the synchronous sessions, prepare you to do the assignments in the during the course.
Thanks, Anton. Daniel's got his hand up. Did you have a question, Daniel? Oh, we just
can't hear you.
Yeah. Did you feel free to type? Oh, that must be so frustrating not to be able to talk.
This is the power of digital.
Yeah. Okay, Daniel's going to type. Time commitment each week. It's difficult, isn't it? Because we do have an indicative guide, which I think is 7 to 10 hours per week, which was on Andrew's slide. But I do know that it depends upon your background. So, for example, Kerry Porter trying to learn about developing analytics. I have a feeling she won't do much work that week because she's probably developed more dashboards than anyone else in Queensland. So, and then some other weeks you might, need to do a little bit more. So I think that's the indicative amount. And Tian Ming, just being mindful that we've assumed that everyone has a full-time job and a baby, because that is the reality of people who are currently interested in digital transformation. So I hope that answers your question. This is not meant to be a full-time student, where you've got all Tuesday to devote to work. We know that everyone's working and busy and has family commitment. Daniel, I'm already in a digital health record in the public system ACT project for the last 2 years. Keith McNeil's been telling me about this. He chaired your board and he's delighted with the project and keeps showing off about it. Can I just tell you that, Daniel? He keeps showing off. Are there any options for recognition of prior learning? So yes, is the short answer. It'll depend upon, you have to submit it obviously. And Buddy or Georgia, do you want to talk through that?
I'm not fully across the RPL, but do you know much about that, Buddy?
Yeah, so any student entering a UQ program can apply for credit or exemptions based on previous study or previous work experience. Once you've been admitted to the program, you'll be able to submit an application. Work experience is a little bit more trickier and will need to be considered on a case-by-case basis to ensure that we maintain that academic standard across the course. But yeah, definitely an opportunity for you, and you can reach out to our team if you need any assistance with that.
Well, whatever you've done, Danielle, clearly done a good job, so according to Keith McNeil. Chia, so what's the difference between them? Great question, Kirsty. So I think Chia is a really valuable qualification, but remember it's a certification, not an education. So really what Chia is about, and AIDH is very clear about this, is it's certifying your work knowledge. That's very different to educating yourself in an academic sense. So the two are going to work in together. Louise Schapper, who's the CEO of AIDH, and I've been in discussions about do you need to do CHIA and grad cert, or are they combined, or how will that work? And the current position is the CHIA will not be necessary for a clinical fellowship, that the graduate certificate, and there's going to be quite a few from different universities. So at the moment, RMIT Melbourne will be the basis, and that academic curriculum will be the basis for the clinical fellowship, not CHIA. Simon, I did 2 hours, 2 nights a week plus the tutorial. Yeah, but you're really clever, Simon. You know.
I think it's one of those things, you get as much back as you put in. It's a little bit like an undergrad. You can just turn up to the final exam and try and, you know, roll through it. But I think it's one of those things, if you like to go down the wormhole when you read an article and then read the next article on from there, you can quite easily get lost. But it's, again, one of those things, if you only want to do the bare minimum, then you may find it a little bit more challenging, and you may not necessarily get everything that you can get out of the program.
That's pretty impressive. Job, exercise, toddler, and life pretty easily. Simon, I need to come and see you for some life tips. I think.
There's no sleep. There's no sleep in there though.
Yeah, I was just looking at that sleep, but anyway. Any other questions? No. So summing up, I guess, you know, we'd be really excited to have as many of you join us as possible. We're going to do everything we can to keep improving the course and to keep bringing practical components from the healthcare system into it, from both a local, national and international level. And I think you're all pioneers. So this is a new area of healthcare, and setting up the smarts and the confidence to lead this is really important to us. And we hope that you can join us on this journey. Nothing else from me, I think, Andrew?
No, I can see there's a few questions just still coming in. So maybe we need to answer some of these before just dropping off. But so Maria, my daughter's Maria, so I like seeing your name. Course offered annually, yes, so that we keep rolling the program on. And where can I view the start of this presentation, Chengmin? So yeah, so we'll record it and then we'll send it out to the list of people who registered. Tyne, I didn't know if you wanted to mention anything in that.
Sorry, I've just answered it in the chat. So anyone
sorry.
who's in this chat or registered will have a copy of the recording.
Okay. And then Katharina said, does this link to a particular master's? Yeah, that's a great question. So I think the best way of answering that is no, we can't, it doesn't exist yet, but the one very exciting part of this program is what Claire referred to earlier about linking to a national fellowship program. And as I mentioned in my little bit in the thing, we're in discussions with our peer groups internationally, so NHS and AMIR in America. And I actually have not, career-wise, I have not been at a point where I could say we are actually at the cusp of doing something of national and international significance. I mean, that's just a pretty exciting opportunity. I think for anyone involved in a program to be able to be part of something like that would be very exciting. I think that's where you would try to go rather than, let's say, I'm just going to do a master's, because there's a bunch of people with a master's. But if it was somehow you got like a fellowship that was nationally recognized and you were one of the first people in a country to be getting it, and then you were somehow linked internationally with the peers, I think, I don't know, that seems to me pretty exciting. But this is happening across Australia right now and around the world right now. So it's not like we can say, oh yes, we've got 5 people who've already gone through this. And, you know, the people who are doing this now are on the first journey of this. And so I just, yeah, to be honest, anyway, maybe I'll stop there. But it is quite exciting, and I think it's more than just like thinking of a master's and stuff. I've lost track in my enthusiasm of the other questions.
No, that's okay. I think actually the course is offered annually, Maria. Yes, so it starts every year. And I think that's actually it for the questions.
Okay. And
just some lovely comments from our VIP students.
Okay. Well, thank you. And especially thank you to the students for coming along today. Kerry, I hope the 5 kids on the beach are still there. And Joe, Simon, thank you so much for coming along. To everyone who joined, it's great to meet you. Hope to see many of you in the courses. yeah, as part of this, actually, a major objective is just simply growing the ecosystem in Queensland and Australia. So yeah, we're doing everything that we can to support that. Thank
If
you.
you have any specific questions, I think feel free to email me. I might not know the answer, but I can send you to somebody who will. But Andrew's right about building up the cohort and the community, and communication is really important part of that. So let us know if there's any worries. A massive thanks to our UQ support team. I also want to acknowledge Queensland Health, who have contributed funding to setting this up, and they've just been fantastic, as well as the Digital Health CRC, who've also helped us fund this, and the federal government. So thanks everyone, and I hope to see many of you next year.
Yeah, see you.